Os parietale.
Os parietale.
This is os parietale, and how to identify if this bone is left or right? There will be like incisura on the end, and see which side it's tending to. If it's tending to left side, here it's tending to left side, so this is right. This is opposite. It's tending to left side. This is angulus mastoideus. If this angulus mastoideus is tending to left, then this is right parietale. Let's start with the os parietale. This is os parietale, and how to identify if this is left or right. As you see, this first you have to find the incisura type thing on the below surface, like niche ka surface, and then see where this angle, this is angulus spinoidalis, where this is tending to. In this case, it's tending to our left side. It's going this side. So this is opposite. This is right. This is dexter parietale. If it's tending to the right, then this will be sinister left. So let's start with the namings. The main margos. This is tending to the front. So this is margo frontalis. This is behind. This is margo occipitalis. Niche, it connects to the squamous part of temporal bone. So this is margo squamosus. And upper, it connects to sagittal part. So this is margo sagittalis. Now, angulus of frontal and angulus of occipital will be same, because margo occipitalis, margo frontalis, angulus frontalis, angulus occipitalis, margo occipitalis. Here is margo squamosus. So this will be SS. This will be angulus spinoidalis, and this will be angulus mastoideus, because it also joins some part of mastoid part of temporal bone. Next, okay, temporal bone. Then this foveolae granulare, just above this angulus spinoidalis, that is the thingy. Above that you will get foveolae granularis, and here next to this, either niche ka side on angulus mastoideus, you will find sulcus sinus sigmoidea. Margo sagittalis, this is margo sagittalis. So just below margo sagittalis will be sulcus sinus sagittalis superior, and all the small sulcuses are sulci arteriosi. Let's go with the sulcus again. Just behind this is angulus spinoidalis, this is angulus mastoidea. Angulus mastoidea ke little bit up you will get sulcus sinus sigmoidea. Below margo sagittalis you will get sulcus sinus sagittalis superior, and all the small sulcis are sulci arteriosi. This is fasces interna. Fasces externa, tuber parietale, but in this parietale bone you will have two lines of temporal bones which passes like this. Linea temporal superior, linea temporal inferior, and then this angulus spinoidalis ke just opposite, either there will be a foramen, like fully diagonal. Here there should be a foramen, which is foramen parietale, and this head part is tuber parietale. That's it. Margo sagittalis, this is margo sagittalis. So just below margo sagittalis will be sulcus sinus sagittalis superior, and all the small sulcuses are sulci arteriosi. Let's go with the sulcus again. Just behind this is angulus spinoidalis, this is angulus mastoidea. Angulus mastoidea ke little bit up you will get sulcus sinus sigmoidea. Below margo sagittalis you will get sulcus sinus sagittalis superior, and all the small sulcis are sulci arteriosi. This is fasces interna. Fasces externa, tuber parietale, but in this parietale bone you will have two lines of temporal bones which passes like this. Linea temporal superior, linea temporal inferior, and then this angulus spinoidalis ke just opposite, either there will be a foramen, like fully diagonal. Here there should be a foramen, which is foramen parietale, and this head part is tuber parietale. That's it. This is the foramen obturatum. Okay, this whole thing, obturatum names will come. This is sulcus obturatum. Okay, this sulcus obturatum. This is foramen obturatum. And then you get two processes. Listen, posterior is this side, so then there is tuberculum here, tuberculum obturatus posterior, and here comes tuberculum obturatum anterior,
tuberculum obturatum posterior, tuberculum obturatum anterior, foramen obturatus, sulcus obturatus, and here this is crista obturatorius, foramen obturatus, tuberculum obturatus posterior anterior, crista obturatus, sulcus obturatus. This is done with here. Let's do the 4 ramuses. Ramus. This is pubis. This is ischia. Ramus superior ossis ischia. Ramus inferior ossis ischia. Ramus superior ossis pubis. Ramus inferior ossis pubis. Okay. Now listen to this rule. Here is this is pubis. So tuberculum. No, wait. Let's do the fascius symphysialis. It's broken, but there's a surface. Fascius symphysialis. Here one process will be coming that is known as crista pubis. Fascius symphysialis, which is broken over here. Wait a second. Yep, this fascius symphysialis. Above that you'll get crista pubis, which is fully broken, like this. You'll get one thingy like this. It would be like this. Crista pubis. That's the crista pubis. We are done with the frontal surface. Let's go to the back. Now in the back, this is the acetabulum. Okay, just above the acetabulum, you'll be having fascius glutinea, because glutinea are as muscles, and this is where the as muscles are connected. Fascius glutinea, and now you have 3 layers. As we know, this is the glutinea area. So here one linea will come, here one linea will come, and here one linea will come. 1, 2, 3. This will be linea glutea anterior, linea glutea posterior, linea glutea inferior. And now there will be 2 labiums on the above surface and 1 linea. The internal one will be labium externum, because this labium is being seen from this surface. So from this POV, this will become externum, this will become internum. But when we are labeling, we label from behind. So this will be labium externum, labium internum, dividing, and the inner one will be linea intermedia. Okay, so now let's revise all the 4 lineas and the labiums. Labium externum, labium internum, linea intermedia, linea anterior glutea, linea posterior glutinea, and linea inferior, fascius glutinea. And then there's a tuberculum over here, as this ilia. There will be a tuberculum present over here. That's name is tuberculum iliacum. That's it. We are done with ileum. Now we know this is acetabulum. Normal common names: incisura acetabuli, fossa acetabuli, limbus. This thing looks like a limbu, like a lemon. So limbus acetabuli, and just above this, below fascius glutinea and above acetabulum, you get a sulcus. So that is sulcus supraacetobularis, because it's above acetabulum. So sulcus supraacetobularis, limbus acetabularis, sulcus incisura acetabularis, fossa acetabularis, acetabulum, and now lunata. Lunata is moon, and surface is fascius. See from here. This looks like a moon. So this is fascius lunata, fascius moon, surface of the moon. Fascius lunata, acetabulum. Acetabulum is everything. Fossa acetabuli, incisura acetabulum, sulcus supraacetobularis, limbus acetabuli. This outer covering is. And now one more thing to remember. Now 2 things to remember as per the rule. We know this is pubis, this is ischia. So pubis has many profits. I don't know why. It has, when you call it the tuberculum of pubis, it's full tuberculum pubicum. But when you call tuber of ischia, it's just tuber ischidicum. And the back surface of pubis has 2 ramuses, whereas the back surface of ischia has only 1 ramus. Let's start. This tuberculum you see is tuberculum pubicum. This is tuber ishidicum. See, tuberculum. Full name is given to P, but half name is given to ishidicum. Tuberculum pubicum, ishidicum, tuber ishidicum, and two ramuses. One ramus comes here: ramus superior ossis pubis, ramus inferior ossis. Ramus superior ossis pubis, ramus inferior ossis pubis, and ramus ossis ishi. That's it. So many prophets like tuberculum, tuberculum pubicum, tuber ishidicum, two ramuses: ramus superior ossis pubis, ramus inferior ossis pubis. But whereas for this only one ramus, that is ramus ossis ishidicum. And now just below the fasces auricularis we have two incisuras and one spina. All are of the same part of ischiadicum. How to remember? This is incisura ischiadicum major, incisura ischiadicum minor, spina ischiadicum. So this spina ischiadicum divides both the layers. So therefore we get two incisuras. This is incisura ischiadicum major. Now when it's coming below, it's divided by spina ischiadica, and in the incisura ischiadica minor is formed. So incisura ischiadica major, incisura ischiadica minor, between you get spina ischiadica. That's it. This is Os Coxae. This is the front view. How to identify if this is the left or the right. If this thing ear type, this is fasces auricularis. So if this ear type thingy is in the left, then it's your left Os Coxae. Os Coxae, that is the hip bone. Let's start. There are three parts. One is ili, ishi, pubis. How to identify? Sometimes it's confusing. Ili is continued into pubis. It's continued into pubis. So this is pubis. See, ili gets continued into pubis, and opposite to that is ishi. Now, how to identify which is posterior side, which is anterior side? This is pubis. P. So opposite to pubis. Once you have identified which is pubis, you can opposite to that is posterior side. P cross P. So this is pubis. Opposite to that is posterior side. Now let's start with the naming. Acetibula, this is ili, so this is os ili, alla fossa ili, alla os ili, or this is the wing of the ili, this is the crista ili, and then there is tuberositas ili, and then there are ili, there are four spina of iliaca. One is iliaca superior,